Good morning. Today being Alzheimer's Day, we have Dr. Ravi Santosh, our mind and memory consultant for Athulya. We'll be discussing about how do we create awareness for this Alzheimer's disease. Dr. Ravi Santosh, good morning. My first question will be, what is the difference between Alzheimer's disease and dementia? Are both the same or it is a part of dementia?
Dementia is a chronic progressive neurological disease, and it affects many domains like memory and planning and executive functions, behavioral problems and activities of daily living. So there are many types of dementia. Alzheimer's is a type of dementia. Other types of dementia are frontotemporal, Lewy body and many other types of dementia.
Dr. Ravi, how do we identify dementia during the early period? What are the early signs of dementia to identify?
The early signs of dementia are, if you see, difficulty in learning new tasks, not able to handle money, memory disturbances like forgetting to eat, forgetting to take medications, frequent anger outbursts and wayfinding difficulties.
Now, once we have identified that they are suffering from dementia, and what will be the management protocol, how to deal with these people and who takes care of them, Dr. Ravi?
So, management of dementia, if you see, can be divided into two parts. One is the medical management and one is the non-medical management. In medical management, there are few medications which slow down the progression of the disease, and there are few medications which take care of the behavioral problems. And the non-medical management, we have cognitive stimulation therapy, group therapy, good nutrition and good physical exercise will surely help them.
I think there should be a caregiver for people who are suffering with the dementia. Now, we always see that the caregiver burden seems to be the risk for them who take care of them. Can you elaborate and give us some insight about that?
Caregiver burden occurs to the person who is taking care of the patient with dementia or any other chronic diseases. It occurs when he neglects himself or herself and doesn't speak about what he is going through. If the caregiver burden is neglected, the caregiver will end up in depression and many other chronic diseases.
Does dementia affect all age group or it's only the elderly people are being affected?
It usually affects the elderly persons, and mean age of onset is around 55 years of age.
I think many of the senior care homes, they take care of dementia people. These elderly people have been taken care in this setup of organizations. Can you explain about how do they take care and what are the safety measures they have there?
Usually need a safe and supervised environment which is fire hazard free and which is electrical hazard free, and they need 24 hours supervision, and they need to understand it should be clear environment. The environment should not be messy, and it should be well lit, and there should be a color coded for the doors and the toilet doors, and the switches have to be color coded. The organizations which have all these facilities will surely help the clients with dementia. Sir, now I request you to highlight on the preventive aspect of dementia.
Okay. I think worldwide elderly people are suffering of dementia. Elderly population is 10% globally, and more than 50 lakh people are suffering of dementia, and most of them do not know how to identify dementia. I think this interaction and interview would help the public to know and identify dementia and put them in a proper care so that they can be safe and the progression of the disease can be controlled.
Thanks.